Okay, welcome everyone for our last session of the European Climate Resilience Health System course. I'm Marina, I'm your moderator today, along with Fadila Arsi for our last session on health communication and education in a changing climate. I won't go over the course objectives that you all know by now, but first, here is the course schedule. So as you can see, we are at the last session. Thank you everyone for being with us until now, and congratulations for finishing the course. Regarding the learning objectives of today, firstly, we want to describe the importance of climate change communication and education about health risk in motivating needed behavioral changes related to adaptation and greenhouse gases mitigation. Second, to identify key strategies to communicate climate change health risks to stakeholders and the public. Thirdly, to explain the importance of audience identification, segmentation, and message tailoring when communicating climate change. Fourth, to identify the potentially damaging or impairing effects of climate change communication on mental health. And lastly, to identify local and national challenges to undertaking health system adaptation and assess possible communications and engagement solutions. For the logistics, as usual, we are on a 90-minute session with a lecture and 2 presentations. We will have a short Q&A session before a few closing words at the end. Sessions, videos, recordings, slide decks, and resources will, as always, be made available on the course website. Regarding the attendance, as usual on this, a quick reminder that it is automatically recorded during the live Zoom sessions and that YouTube views will not count towards attendance. For the certificate of participation, we will have more details at the end of the session for the final exam, but participants who attend more than 70% of the live sessions and pass the final exam with a score of more than 70% at the end will be awarded a certificate of participation in climate and health from ASPHER and the GCCHE. The certificate of participation is only available to people who use the same email for registration, all Zoom sessions, and exam. And now I'll leave the floor to Fadila to introduce our first 2 presenters of today.
Yeah, thank you, Marie, and hello, everyone. I see that everyone has started to join. My name is Fadila. It is a pleasure to co-moderate the last sessions with Marie on health communications and education on changing climate. We have learned throughout the last 9 sessions on how important and how to approach measures and policies on in the health system to face climate change impacts. Of course, it will be hard to actualize that without a proper health communication strategy. This is why it is an honor for me to introduce the 2 key panelists that will present and share their thoughts and experience on this. Our first key panelist is Laurent, who is the director of ASPHER School of Public Health in Iran from 2013 to the end of August 2022. He was previously also an advisor in charge of the organizations and animations of public health policy and health security to the Ministry of Social Affairs and Health, Marisol Touraine. Laurent is right now a member of the French National Consultative Committee on Ethics and a senior lead on climate change and health for ASPHER. Our second key panelist is Eric Twomey, is a medical doctor and PhD candidate in environmental epidemiology at the Swiss Tropical and Public Health Institute, where he investigates the health impact of ultrafine particles. And since 2024, Eric has also served as a fellow on climate and health at ASPHER. He supports the pan-European collaborations, policy development, and climate and health educations. And without further ado, I would like to invite Laurent and Eric to present their thoughts and experience on subjects. Eric and Laurent, the time is yours.
Thanks a lot, Fadila. And I will first share my screen. And I hope that you will see Do you see the screen?
Yes.
Okay. Okay, perfect. So hello to everybody. And I'm like always amazed by how many people join us for this last session of the European Climate Resilient Health System course. So welcome to everybody from all Europe and from all the world. We, with Eric, will try to convince you that communication and education are key factors to fight climate change consequences on health and to build resilient health system. So let's go. And let's go. I think I will. Okay. Why to communicate on climate and health? There are four main reasons that you see on this slide. Firstly, climate change is the biggest global health threat from this century, according to WHO, but according to many people and many scientists. So we have to tackle this global health threat. Secondly, it is important to collect and share updated knowledge on the direct and indirect effects of climate change, because climate change affects health and healthcare system. Sorry, I have a problem with my screen. It's okay. Climate change affects health and healthcare system, and by direct effect, like heat wave, flood, mental health, and indirect effect, like quality and safety of the water, access to water, climate migrations, and so on and so forth. The third one is that we have to communicate, because communication is a component of public health competencies. Health communication raises awareness, promotes protective behaviors, and encourages system change. And finally, and it's really important to stress this point, health professionals play a major role, because public trust in health professionals positions them to lead on climate health messaging. So communication has to deal with the two sides of actions. The first one is adaptation. In terms of adaptation, communication tools prepare communities for climate impacts, like heat health alerts, emergency preparedness, or early warning systems. We have to develop this. But also, we have to prepare our healthcare facilities to face new needs and new challenges in health. So that means that communication helps us to prepare this change in our healthcare system. In terms of mitigations, communications supports and promotes climate-friendly behaviors like active transportation or like plant-based diets. But also, communication enhances efforts to reduce greenhouse gas emissions in the healthcare system. And more broadly, we think that communication is a tool to assist the transformation of healthcare systems. The crucial role of public health professionals, alongside with other health professionals, could be seen in the four main domains you see in this slide. Firstly, we have with clinicians to advise patients on climate-related health risks and preventive measures. Secondly, and also with the help of the research community, we have to generate evidence on climate health connections and effective intervention. It's not only the science of problems, it's also the science of solutions. We have to work also with the educators community to translate complex science into accessible public health messages. And finally, we have to advocate, to speak up for policies that protect health in a changing climate. So now, how to communicate effectively? Here in this slide, you find four key principles that I think it's important to keep in mind. The first one is to focus on health. It's climate change and health. So that means that we have to connect climate issues directly to health impacts that people care about. The second one is to be simple, to be local, to be action-oriented, to use clear language that relates to local experience and to suggest specific actions. Third key principle, to balance between urgency and hope. We have, of course, to look at what is the dimension of this problem, but we have also to present solutions alongside problems to avoid overwhelming anxiety. And finally, we have to tell stories. We have to use narrative and emotional connection rather than just presenting data. And here you see one. I would like to stress this scheme, because this scheme is scientifically right, but it's complex. It's complex because you will see on the screen, you have the different countries, you have age groups, we have some raw death rates for cold waves and heat waves, and also you have a different scale at the bottom. You have a different scale for the raw dates for cold raw days death and for heat raw days. So that means that it's very complicated. So it's good for a master module or doctorate module, but it's not good to communicate it for a large communication. At the opposite, this one is really easy to understand, because you have the evolution of tiger mosquito in the different French departments in France. And you see very clearly, very easily, that in 2004, there was only one place in France where the tiger mosquito was settled. And 20 years after, you have quite all France where this mosquito is settled. So it's really nice to have this kind of maps just to show to the people what happens in terms of climate change and health. And another thing is about this image. So when you see the two different images, you have two different stories. On the left, what you see that you have a problem, a very important, a very big problem. You look at the importance of the issue, but you have no solution. So it's quite hopeless. At the right, you have a more reassuring image, because the image is really nice. You have also hope by action, because it's a knowledge to action resource guide. Perhaps it's a little too soft. So that means that you have also to balance between having some images that look at the severity of the problem, but also to give solutions. Sorry, I will come back just because I just forgot these two slides. because you have to consider also your audience and goal before communicating. And here, if I look from the bottom of the pyramid to the top, you have different publics, different audiences. At the bottom, it's public health professionals. So public health professionals have to be aware of this issue of climate change and health. But you have also healthcare providers, you have policymakers, you have wider professional audiences and people like planners, economists, educators, social workers, and so on and so forth. And at the top of the pyramid, you have the citizens and the non-governmental organization, because we need to develop community empowerment and to mobilize all the people, all the community, so grassroots mobilization. The communication also, we have also to, we have also to communicate among different levels. And you have the local levels, from the local levels to the global levels. And all these levels need different type of communication. At the local levels, you have local governments, community campaigns, and also all the people who are responsible of health facilities. At the national level, you will tackle more ministry strategies, national public health institutes, and emergency responses at the national level. At the European level, you will ally with different organizations like ECHO, the European Climate and Health Observatory, and you will have a representation by Aleksandra on that, or with the community of School of Public Health like we have in ASPHER. And at the global level, we have to be present and to support different institutions like WHO, like the Global Consortium on Climate Health Education, and thanks for them to participate with us on this course. The Conference of Parties, and we need to be present in Brazil this year. And also we need to feed IPCC, because we are part also of the scientific community to develop knowledge on the climate change and health. So this has been just shown. And if I go now to this one, I would like to say that statistic and scientific knowledge is not sufficient to convince and to increase awareness of people. So that means that we have to tell stories, and we have to develop some real case studies that speak to the audience. And here you have this toolkit for health professionals by WHO, and I would recommend to everybody to look at this toolkit, at this document, because it's a new one. It has been issued last year. It's a very tiny, very short one, 40 pages, and it gives you some clues about how to communicate. So please look at this document from WHO. And in this document, you will find, for instance, two different case studies. The one is flooding compensations in Colombia, with an experience of Paola Arias, who communicated during a flood event, and it's very, very interesting. And the second one is very well known. It's the case of Ella Kissy Deborah. She died she was, I think, 12 or 11 or 12, and she died in 2013 in London by an excessive air pollution. And this resulted in a modification of the legislation in UK. So here it's really case studies that speak to the different audiences. Now I would like to look with you to what are the gaps and needs in communication. We have selected 4 current gaps. The first one is we have fragmented institutional messages. We need more strategic and coherent messages. We have a low investment in communication. We need more investment in communication and mainly in public health. We have limited climate literacy, so we have to make progress on that. And we have inadequate training and mainly in communication and public health. So the urgent needs, the four urgent needs are, firstly, an institutional support and training for this matter. We have to fund communication units and to be able to communicate adequately to the different targets, to different publics. We have to define coherent national strategy, and we have to keep in mind equity first approaches. We have to tackle inequity everywhere, and we have to develop climate justice. So just remind and remember that the health sector must not speak to itself, it must speak to society at all. And finally, my last slide. In my last slide, I would like to highlight four key messages. The first one is we need robust climate competencies for health professionals, including competencies in communication and health. Secondly, all stakeholders must engage in healthcare transformation. It cannot be done only by the health professionals. We have seen that a balanced approach, that means that we have in the same way to communicate on the emergency, on the urgency of this challenge, but also highlighting opportunities and solutions. And finally, we have to develop practical action. That means that we have to apply updated knowledge to define policies, to create resilient system, and mainly by case study. So as you have seen, communication and education are closely linked. So now Eric will talk to you about education. Eric, the floor is yours. And I will stop my, sorry.
Yes, thank you very much, Laurent. Very, very appreciated. We'll briefly share my screen so everyone can see and hear me, hopefully, in what I want to display today. So yeah, I will briefly go over the topic of climate change and health education with an emphasis on climate change and health education. You might have noticed that oftentimes it's referred as climate and health. However, it's the changing part of the climate that makes it so dangerous and risky and interesting at the same time. So yeah, as you might have seen and registered in the last sessions, the climate change goes along with a learning challenge, and it's really about conveying a lot of messages. Sometimes it can be a little bit overwhelming in a short time, and we see there's an urgent need for the public health professionals to really understand what is at stake here and what needs to be done to address climate, the changing climate, and to mitigate it. So first, when we talk about climate change and health education, we have to briefly go through the different concepts that exist there, just to know what we're talking about, what we're not talking about. That's quite necessary. And a lot of you will already have stumbled across these different frameworks. We're talking about planetary health, One Health, environmental health, and climate health. And while they are all somehow connected, or while they intersect strongly, there's still a slight difference between all of them. And while, for example, planetary health encompasses really a very broad spectrum and very broad scope, when we talk about climate and health, or climate change and health, it's tackling a very concrete problem and a very concrete scenario. So it really centers on that direct and indirect impacts of climate change on human health. And the aim is to develop practical competencies and for risk assessment, preparedness, and equity that you hopefully have all gone through in the last sessions. So why is that so essential for health system resilience? Of course, WHO states that training of public health professionals in climate and health education is essential and is a core building block for climate resilience. It is really necessary to prepare all students and continuously educate all health and public health professionals for these real world impacts that climate change brings with it. And that kind of education, understanding the climate health risks and how to really lead an adaptive response on an event, be it a drought, be it a flooding, be it a heat wave, is pivotal for every health professional, and really also to influence institutional and policy change on a local level, but also on a regional and national, depending on where you have your influence. So what's the current landscape looking at Europe? The Global Consortium of Climate and Health Education has done a survey last year and the year before to try to assess where we are at the moment in Europe. They did it globally, but also in Europe. And they asked a lot of institutions that provide public health education and came to the results that at least in Europe, those institutions that responded, over 80% offer some kind of climate and health training, which already is very good, which is above the global average. Looking at the different levels of education, we saw there that especially master's level have a strong coverage, and then followed by an undergraduate and vocational, where it is a little bit more limited. And we see some discrepancies between the regions where Western and Northern Europe is a little bit more ahead than compared to Eastern and Southeastern regions, because probably they have quite some barriers that are important. But we also have to acknowledge that there's a positive momentum at the moment with the Green Deal from the European Union, the European Climate and Health Observatory, and the network that is established by GCCHE. So we are in a good development, and we would really try to amplify that. So when we talk about that climate change and health education, what exactly should be taught? So there's 4 main areas we can identify, and they have 8 domains, which cover fundamental science, like the physics of the chemistry, natural science behind climate change, the climate drivers and surveillance, that is very important, the stakeholder engagement, communication, as Laurent has just said, and the system adaptation and health equity is very important as well. And additionally to these 8 core domains that were initially defined by GCCHE, ASPHER has added planetary health and One Health and climate justice to also be learned. And we always need to stress that practical training must include risk assessment and policy communication. So we have different educational levels. Most countries offer some kind of vocational training, where it's mainly about awareness and preparedness. Then we have bachelors, where the core public health perspectives are conveyed on climate change. Then we have masters, where you go more into depth and you focus on adaptation, health systems, and the policy. And climbing up that ladder, finally being at the doctoral level, it's more about the research, modeling systems, and really advancing the knowledge on the topic. And every level requires different content and depth, obviously. And the education is not only for students, but also for the entirety of the health sector and the public health sector. And it really requires a continuous improvement and training for every participant in a sense of continuous professional development. So next question will be, how do we teach it then? How can we find it? How can we make it engaging? And obviously, as we try to do and emulate a little bit in this course as well, a bit more challenging with more than 1,500 participants, but make it participatory. Like if in a local setting, really try to get a discussion going on it, make a lot of case simulations, role play maybe. Make it interdisciplinary, not only amongst students, but also amongst educators. Every educator will bring another expertise to the topic, and try to stick to local scenarios, because people really connect it better when it is something about their local surroundings, regional surroundings, where they understand what is happening. So yeah, and that teaching climate resilience requires an active, experiential and applied learning. And that is to engage the students through simulation, case studies, and digital platforms. We have just looked for best practices and examples, some of which you already got to know through this course. Just to give brief examples, there are many more we know by now, but giving one is the Erasmus University in Rotterdam, Netherlands, that provides a sustainable healthcare track that includes system thinking and stakeholder engagement and decarbonization. Second, there's Institut Pasteur in Paris, France, that provides the Climate and Population Health Week that covers the basics from the IPCC, epidemiological methods and adaptation strategies. And something that was mentioned in this course a couple of sessions back, sorry if I'm butchering that name, but it's the Nicolae Testimitanu State Medical University in Moldova, who provide training for healthcare managers, which is also pivotal, not only the clinicians, but the ones managing the whole process. And they do promote the health resilience. What gaps and barriers can we identify? So there's a couple of gaps and barriers that are important and that have been identified also by GCCHE. First of all, there's not enough capacitated faculty that is able to teach profoundly on the topic. So there's a lack of trained educators. Second, most curricula are already filled, and to fit in another topic is always challenging, but it must succeed in some way or another. Then there is a limited opportunities for continuous professional development for those who aren't students anymore, already professionals, but they want to know more about the topic. There's that inconsistency in framework, sometimes that I've mentioned early, and regional inequalities that are often a result of languages and access to technology and culture that makes it difficult for some people, students, the open public, to get access to this kind of knowledge. And so important things are to scale up the training everywhere throughout Europe and globally, obviously, and also in particularly in the regions where public health schools are underrepresented. And also addressing these gaps requires policy, again, funding and institutional support, as we've just previously heard in the communication part.
Eric, I'm sorry, you have 2 minutes to wrap the presentations.
Yes, thank you. I'm always done.
Yeah.
Just to conclude, so this is what we do at the moment, together with our partners from the EEA, Lancet Countdown, and Columbia University at the GCCHE is located. So we build a climate competent health workforce. We promote a common EU education indicator. We launched an education repository and filling this with different courses across the European region. We expand the responder course, trying to go to the third year then, next year. And we promote the student engagement and advocacy. There's a very nice citation from Aaron Bernstein from Harvard Chancellor of Public Health I really like, is without teaching climate and health, we prepare students for a world that does not longer exist. And with this final slide, I would like to close and to call for action. It is how you can contribute, everyone in the audience. These are 5 points how you can help us, help everyone. Is pushing for institutional advocacy. Share your knowledge, disseminate what you learned and what you will learn. Develop your own skills and the skills of your colleagues. You can also mentor them in a sense, and amplify that impact of sharing stories of success and challenges through your professional network. And with this, I would like to close my lecture. Thank you very much for your attention, and I'm looking forward for your questions. Thank you.
Thank you, Eric, so much. And now, without further ado, I would like to call Aleksandra Kazmierczak, who is an expert in climate change and human health at the European Environment Agency. She coordinates the European Climate and Health Observatory, which is a partnership between the European Commission, the EA, and several organizations. Aleksandra, the floor is yours. Thank you.
Thank you very much, and hello everyone. Good afternoon, good morning, good evening, wherever you are. In this brief presentation, I would like to talk about an initiative that I have the pleasure of coordinating, the European Climate and Health Observatory, with the focus on the topic of today's session on the communication. So I would like to start by introducing where I actually come from. So I'm working at the European Environment Agency. We are based in Copenhagen, in Denmark, and we are one of the independent agencies of the European Union. And our main job is to collect the information about the environment from our member countries. They go a bit further than the European Union. To analyze it, repackage it, and communicate it to policymakers at the European level, at the national level, sometimes even at the subnational level. So we are very much sitting on the fence and at the interface between science and policy, trying to find a way to communicate between the scientists and the experts on a variety of subjects. So you may ask yourself, why is the European Environment Agency present at the course on public health? It is because we are co-managing together with the European Commission an initiative that is called European Climate and Health Observatory. It was launched in 2021, and it's very much a partnership, which in itself requires quite a lot of communication, because we have the Directorate General from the European Commission on Climate Action and the Directorate General on Health. We have the European Environment Agency, and we have a number of other European agencies and organizations that are either working on health or on climate, on both, or really on neither of those, but touching upon the subjects that are really of importance to climate and health, such as our working conditions or living conditions, for example. So we have a portal, and I would like to warmly encourage you to have a look at it. But why was the observatory established? It's written into the European policy, and it was observed in 2018, when the previous European strategy on adaptation to climate change was analyzed, that there was not really sufficient understanding of the climate change impacts on health, and also what solutions could be applied. So we didn't really have the knowledge base to use for communication on climate change risks and for addressing it. So the European adaptation strategy from 2021 said that the European Climate and Health Observatory should be established. And in the European law, it's been written that our job is to better understand, anticipate, and minimize the health threats caused by climate change. So the observatory was launched in 2021, and together with the partners, it took us quite a few months to decide what we actually want to do and where we want to arrive. But together with the partnership, we set up those strategic objectives for the observatory, where we would like to be by 2030. And it was that the observatory users should be able to monitor the key climate-related health risks through indicators, that the national and subnational health policies and systems should be able to integrate the adaptation to climate change more systematically and consistently. Thirdly, that the public authorities have greater capacity to anticipate and prevent climate-related threats to health in a timely manner. Fourthly, the health community in Europe is climate literate and better involved in adaptation decision-making. And the fifth objective is that we communicate well on the solutions that could be taken, which are effective, efficient, and inclusive. So all these objectives really require an effective communication of knowledge and making sure that it's understood and picked up by our key stakeholders. So what I would like to do in this presentation is to run quickly through those 5 objectives and give you some examples of how we present the knowledge, how we communicate the knowledge that can be then used for decision making. First of all, when it comes to the objective on having robust indicators, we have indicators on a variety of subjects. And firstly, the climate hazards. Climate projections are quite complex and difficult to understand. But for example, our colleagues from Copernicus Climate Change Service have done a really good job to present those projections at regional level, at the level of administrative unit, which means that they are more easily understood by the decision makers in a given country or region, or a sort of, even a smaller region or municipality level in some examples. Secondly, vulnerability of the population is, of course, the other side of the coin that generates the climate impacts on health. And here, a sort of a big bow to our colleagues from Lancet Countdown in Europe, who have been able to present the vulnerability of the population, the different factors related to the aging society, to prevalence of chronic diseases, urbanization, in a way that sort of gives an understanding of which regions are the most vulnerable, which regions are becoming more vulnerable at the greatest pace. We also present indicators related to exposure. And here, for example, we mapped the distribution of hospitals against urban heat island effect in Europe. And these sort of numbers, when we communicate with policymakers, are actually quite powerful to say that nearly half of urban hospitals in Europe are exposed to higher levels of heat than the rest of the city. It's a message that really resonates and makes people think of what could be done about it. And here an example from ECDC, the European Center for Disease Control and Prevention, similar to what Laurent was presenting about the distribution of vectors that may be spreading infectious diseases, a very sort of effective mode of communication. We also collect the information about the health impacts of climate change. For example, the fatalities linked to floods, or the cases of dengue that are collected by ECDC. Here, of course, it needs to be taken with a pinch of salt, because not every fatality related to floods can be attributed to climate change. And the same, for example, with the cases of dengue. In Europe, there are many travel related. So there's a sort of, a need to unpack this information a bit when communicating it. Another important aspect, and that sort of resonates with what Laurent was saying, that we need to sort of balance the urgency with hope, with also the indicators related to responses. So, for example, we looked at the presence of heat health action plans across Europe, and now we know that in 21 out of 38 countries that we looked at, that such heat health action plans are present. And also this sort of message really resonates with the policymakers who, when they see their country in red or in orange, see that there might be a need for action there. We also look at the different types of responses, such as, for example, the presence of green space around hospitals. And here again, a sort of a really clear message that is coming is that the green space that can be used for cooling or stormwater management is really less abundant around hospitals than in cities in average. And related to the topic of this course, response, one of the very important responses is the education of the healthcare and public health students and professionals on the subject of climate change. The International Federation of Medical Students Associations ran a survey in 2020 in which they identified that about a quarter of medical schools in Europe are running some sort of formal education on climate change. And in 1/5 of the schools, actually, the students are organizing themselves and teaching each other on climate change. So there's a real appetite for this type of education. And here, to sort of repeat the slide in a slightly different version that Eric was showing, in Europe, in the case of schools of public health, we have sort of a much higher coverage of climate change education, with 80% of responding schools highlighted that they have some sort of climate change education in place. The second objective of the observatory is that the national and subnational health policies and systems can integrate adaptation more systematically and consistently. And here the good news is that health is really recognized as the most vulnerable sector to climate change in Europe. The countries that are reporting to the European Environment Agency on the mitigation efforts, on the energy change efforts, and also on adaptation under the regulation on governance of the Energy Union and climate action, highlight health as the most vulnerable sector of all. So there is a good understanding of the urgency of risks there. A few years ago, we looked at what actually the countries are doing in terms of the national policies on climate change adaptation and the national health strategies, which sort of actions they plan to address health impacts. The first message that we got from this analysis was that many more national adaptation policies are looking at climate and health compared to the national health strategies. So that was a sort of a strong signal for us who we should be communicating to. So the European Climate and Health Observatory changed tack a bit, and from communicating mainly to climate adaptation experts, we started communicating much more with public health and health professionals. The second thing to highlight here is that there are actions being planned aimed at awareness raising and also aimed at education and training of health professionals in a substantial number of these national adaptation strategies and national health strategies alike. But there is a big but, because in most of the climate adaptation strategies, then climate adaptation should be realized at the subnational level. So it's the municipalities, cities, local authorities that should be taking care of adapting to climate change. And here we see a very messy chart showing the number of actions that are planned by the local authorities that are members in the Covenant of Mayors for Climate and Energy. And here we can see that health is not really at the first priority, but it's a fifth ranked type of sector in terms of the number of actions being planned. So what we see is that there is a really big discrepancy at the local level between the climate adaptation actions and the health actions, that health sector stakeholders are not really engaged in climate change adaptation at the local level. So when you think about the communications, I would say that they are probably the strongest at this local level, because at the national level, we see many interministerial, agency groups formed between climate and health, but this connection is very often missing at the local level, where climate change adaptation is still very much the job of the water management departments, environment departments, spatial planning departments, rather than a sort of a health issue. Our Third objective is that the public authorities should be able to anticipate and prevent climate-related threats to health in a timely manner. So here it's a communication that should come to present the sort of the forecast of what we can expect in the short term, warnings or evidence supporting decision making. So in the European Climate and Health Observatory, for example, we have the forecast of air pollutants, which of course, when combined with high temperatures, especially, can be really damaging to human health. The colleagues from ECDC have this Vibrio risk map viewer, which is showing them risk of Vibrio bacteria, the coastal pathogens in the seas around the European coasts. And we also provide evidence that can sort of maybe refocus the efforts of the authorities to look at the subject they might not have thought about, such as mental health impacts or occupational health impacts. Our fourth objective is about increasing the climate literacy and of the health community in Europe and better involving them into adaptation decision making. And here, for example, we have a number of case studies describing different initiatives that are present in Europe that aim at increasing this climate literacy. For example, the Nurses Climate Challenge Europe, an initiative run by Healthcare Without Harm, is trying to and actually doing very well in educating thousands of nurses across Europe on climate change. So then they can become the champions of the topic and teach and educate their patients, but also sort of provide the knowledge upwards to other stakeholders as one of the most trusted professions. We have some examples of courses on different aspects of climate change and health. We have a case study from last year's ASPHER and the GCCHE European Climate and Health Responder course. And also recently we actually set up a page within the Observatory on climate and health education and training, where we provide an access point to some training and learning resources, and not least the ASPHER database of training and learning resources that is currently in development. Our fifth and final objective is to make sure that the adaptation solutions and public health and healthcare intervention are widely known. And what we are trying to emphasize in our messages that when we look at different stages of disaster risk response, that action is really needed at the prevention stage, preventing the health impacts from happening, preparing for the health impacts to happen, but and maybe to a lesser extent, because then it's usually a bit late, responding to the extreme weather events and other health crises under the climate change and the recovery stage. Here, again, we emphasize the importance of the awareness raising of risks among the general public, but also among the different professionals, and in particular, the healthcare workforce. But I think it needs to be emphasized that the communication of climate risks is also needed in relation to many of the other actions. One of the quite really sensitive subjects is the relocation of population from high-risk areas, and of course, the health impacts of, for example, flooding wouldn't happen if no one lived in flood risk areas. So minimizing the number of people living there is really imperative, but it's quite a sensitive subject requiring very sensitive communication. And also, for example, the efforts to minimize the mental health trauma after extreme events such as flooding or wildfire has happened is an example of the communication effort. In our repository of case studies, we have a number of case studies that have this strong communication aspect. For example, how to communicate the health risks to elderly people who might be at the highest risk during heat waves from the Kassel region. then development of a flood-proof hospital in Denmark, which actually required quite a lot of consultation with the staff working in the hospital and a variety of other stakeholders on what sort of design would meet their needs the best, as well as being climate-proof. A case of managing the risk of food poisoning, which required a very close collaboration between the Fisheries Department and then Public Health Department in Canary Islands in Spain. We also have a case study on how to manage the eco-anxiety, an initiative of a non-governmental organization in Finland, working especially with younger people, but also those very exposed to climate impacts, such as farmers and rural communities, on how to deal with the worries and the distress associated with climate change. A case of what I mentioned before, this mental health support for flooded populations. And also even the case where then citizens or people actually are becoming the champions and the leaders in providing the information that is related to climate change and health, such as monitoring the mosquitoes, smashing them and sending the specimens for experts to identify whether they can be carrying infectious diseases or not. So with that, I would like to close, and I would like to warmly encourage you to have a look at the Observatory website and see how the resources that are included there, how you can use them in communicating on climate change risks to human health. So that's it from me, and thank you very much.
Thank you, Aleksandra. And now we would like to introduce Daniele Magalhães, who is the Senior Project Director at the Global Consortium on Climate and Health Education, where she leads global training initiatives. Thank you, Daniele. The floor is yours.
Thank you so much. Okay, welcome everybody to our last session. I will talk about capacity building and how the Global Consortium on Climate Change make this training and capacity building in a scale to solve all these crises that we are already seeing, since climate change is so big now and we need to train as many people as we can. And I will show you some example. When we're speaking about capacity building, we are talking about knowledge and development of skills and methodology and resources to change something. And when we talk about capacity building on climate and health, we go beyond that. Because normally capacity building is considered as a means of implementation. It's just something in the middle. But in climate and health, capacity building is also part of adaptation. It's considering adaptation. When you are depend on the audience that you are training, it's part of adaptation. And this capacity building is not only important in one point of time, but it needs to be integrated throughout the time. And it needs to integrate many different stakeholders. We need individuals, we need organization, we need communities. And even if we're thinking about to build a resilient health system, if we think in a health center, we need to build the capacity and train everybody, from the person in the reception to the person that will drive an ambulance, and everybody needs to have some information about climate change so we can make it happen. So, but there is a gap in the world. So when in 2021, WHO conducted a survey among these their country members, and they realized that 54% of the countries flagged insufficient human resource capacity as the main barrier to implement national health and climate plans. And 46% of them reported insufficient access to tools, methods, and technologies. And this gap continues today, as we saw that during the World Health Assembly in 2024, there was a resolution asking the Director General to provide capacity building for health professionals, providing training in the interdependence between climate change and health. So thinking of that, in 2017, the Global Consortium on Climate and Health was created. 60 US academic institutions came together and realized that health professionals need to have a differential training to tackle and to deal with climate change. And today, our mission is to ensure that all health professionals in the world have the knowledge and skills to identify, prevent, reduce, and respond to health impacts of climate change, thereby reducing the health disparities and improving quality of health and well-being. So today, from the 60 in the beginning, we are about 400 member institutions all around the world, and all these member institutions pledge on the dean level to provide climate change education into their public health or any other health degrees. And we estimate that this consortium of academic institutions now is training about 250,000 students per year. GCCHE acts under a 6 approach. We have student education, professional training, consultancy, policy and advocacy, fellowship programs, and community engagement. And to deal with all these activities, we developed the core competencies that all health professionals should have to deal with climate change. And these core competencies are divided into 5 domains: knowledge and analytical skills, public health practice, clinical practice, policy aspects, and also climate and health communication. I can share with you these core competencies. I will put in them in our material resources. And basically, these core competencies guide all the curriculum that we developed and can also be used for you to develop your own curriculum in your institution, and also to guide some trainings among your colleagues and inside your institution. And the training that we provide, they have 3 different levels. Level 1, foundational climate and health knowledge and skills. Level 2, implementation, application, and decision maker. And level 3, leadership. And with all this training in the last 3 years, we train over 35,000 health professionals all around the world. The training that you are having here, it's a level 1 training. It's a foundational level, and it's already sufficient to build awareness, to communicate, and also to respond and prepare. So I hope that after this training, you will be more confident to act in your practice, and also to implement all the climate plans on this. But when we thinking about climate education and training, we need to consider that there is some differences. There is difference between location, there is difference between culture. And I brought here 2 statements from our participants in our trainings, and I want to read them. So so you can identify some of the vulnerabilities inside and some things that we need to take in consideration when we plan some training. So for example, the first one is from a female community health worker in India. She said that during the heat waves, communities often need extra support due to discomfort caused by extreme heat. Increased water usage can result in shortages, and there is a higher demand of cooling solutions like fans and air conditioners. Additionally, challenges arise from limited access to essential supplies, staff and resource shortage, power outage that disrupt medical service and transportation difficulties. So can you put in the chat, for example, all the vulnerabilities that we can see here, all the challenges that we can see here to build an effective training? Can you put in the chat, please? Essential care and service, and we have a lot of socioeconomic vulnerabilities, and these circular economy, infrastructure challenges, limit of resources, inequality, lack of power, stability. Yeah, we have a lot of challenges that make this population even more vulnerable and more exposure to this climate effect. And in this other statement from a participant in Africa, it says that in some African traditional communities, there is a belief that consuming large amounts of water or cold water can complicate labor. These misconceptions are leading to increased miscarriages and other health issues for pregnant women, particularly during the hot season as dehydration becomes a significant concern. So here we have a different situation. We not only have the social and economic vulnerabilities, but we also have a cultural aspect that needs to be considered when you are providing a training and when you are providing a communication. So all this particularity from a local perspective, for a community perspective, needs to be considered when you are planning a communication or a training. So to make this training scalable and to reach many people, the solution that we found that maybe it's not the best one because it will not bring all these specific challenges, but maybe it's the way that we can train a lot of people and try to find some similarity among them, is to create this training among different regions. So we have this training that it's our flagship. It calls Climate and Health Responders course. It's also a level 1 we did here in Europe last year. And we have the Climate and Health Responders in the North America, for the Caribbean, to the Latin America. We did in Africa. We are finishing one in the Western Pacific. And we will start one in May in the Southeast Asia. So in this course, we try to bring our core curriculum, and we make changes to adapt to the local challenges. And we invite local experts to talk about their problems and their solutions. And as in this course, we have experts from different countries in Europe. So you can have all this taste of different culture and also different challenges. And that's what we do. And with this course, we have been training 10,000 health professionals per year. So this is how was the European Climate and Health Responders last year. It ran from February to April. We have more than 4,000 registrants from more than 165 countries. So the courses are open for everybody, not only for Europe. And people can take it because they want to know more. They want to know what is Europe is doing. How can I do in my country as well? So it also promotes this exchange of knowledge. And but at the end, we have 936 participants that conclude the course. They attend at least 7 sessions and pass in the final exam. So you can see that we have only 25% of the whole participants at the end conclude the course. And I have to say that from these 4,000 people, 70% never have received any type of training before. And when we analyzed this 70%, we saw that only less than 30% are students, so most of them are health professionals. And this is very critical, and it shows us how we need to keep going and to provide this type of training. So here are the sessions. We have 10 sessions last year as well, where we address all the major impacts of climate change and the connections with health, and how health professionals can act and can bring solutions to all these situations. And here is the results. It's a self-reported survey that you will all be invited to take as well after this course. And we can see that in terms of preparedness, how prepared people feel to decarbonize and become more resilient, the health system, and how prepared they feel to help their communities to adapt. We saw that people improve their self-confidence and they feel more prepared, like 40% more after the course than compared to before the course. And when we ask about professional responsibility in decarbonization and with the community to adapt, we also see that their responsibility, their sense of responsibility increase by around 17%. And when we talk about awareness, how climate change affects your professional practice, we also saw that there was an increase of almost 30% of awareness. And related to confidence to communicate, we also saw an increasing in more than 30%. So at the end, this course was very successful and to bring not only awareness, but to build confidence in communicate and also confidence to prepare and to respond to climate change.
Daniele, I'm sorry, you have 2 minutes for the presentation.
Okay. I'm going to finish. So, and also to monitoring our efforts and how the countries are prepared to adapt. We are conducting this global survey among schools of public health, and also medical schools. This year we are going to include nursing schools, and where we ask them about how they are, if they are providing climate education, and also what is the degree of proficiency that the students are receiving this type of knowledge. And this information is now part of the Lancet Countdown. It composes an indicator about adaptation. And here it's our results in Europe last year, in 2023 and last year. We can see that most of the schools are providing climate and health education. But when we see in the first graph, in the 2023, 33 of 66 schools, they are providing as mandatory, and some of them are also only provided as optional courses. So we need to make this mandatory in all health professionals' curricula. And here, just to give you an idea of another way to make it bigger and scale the training, this is a training that we do in Africa. It's a train-the-trainer workshop and approach where India had in the past the biggest mortality rate related to heat, and now the government is engaged to training every heat season all the health professionals, all the community health workers, and the community to be prepared to and to act against heat. And so we have one session, we translate the materials in 3 languages, we train in 91 trainers, and these 91 trainers trained to more than 2,000 frontline workers. And these frontline workers inform and communicate the risks to 85,000 individuals. And then we developed this pocket book that was used by the health professionals, and also some fact sheets that was distributed among the community, so they can have some practical and simple information on what they should do and what they should not do, and what are the most vulnerable population that need more attention. Just to finalize, I would like to invite all of you to join GCCHE as a member, as an academic institution, or as an individual member. Maggie will put the link in the chat, and we have many other initiatives that can help you to build your curriculum and to be among colleagues and share opportunities. So thank you so much.
Thank you, Daniele.
Daniele.
Sorry for the...
Yes, okay.
I think we would like to have all the speakers come to the floor for a very short Q&A session. And we have one big question that I think all of you could shed some light on. Yes, I think we have everyone. So we got a question at the end, which is, to what extent any type of communication training activity focused on increased climate literacy should have the objective to promote a change of, in brackets, voting behaviors and a call to action from citizen healthcare professionals to actually demand governments and institutions to phase out fossil fuels and ensure an equal, ethical, and just transition? And if there is any evidence-based strategies on that. I think this is a big question enough for all of you to shed some light on, if you can. I don't know who would like to start.
Maybe I can start. I think all of our trainings and all the communication in climate and health, we need to make sure to show the drivers, right? And we need to make sure that people know the drivers. And it's about fossil fuel, it's about the burn of fossil fuel, but it's also about consumption. It's also about individual behavior, and everybody can contribute. And also knowing the reasons, knowing the drivers, we can change. We can, like I said, when we're thinking about capacity building on climate change and health, we are already bringing some information that people will realize in their daily life that something different has happened, and I'm already suffering. People have more respiratory illnesses. People have more problem with heat. They don't feel right when they are exposure during the whole day to a very hot day, so they will learn how to protect themselves and they will change their behavior. So that's why when we train, when we communicate, we can make these changes in behavior and we can make people safer.
If I can just add a few words on that, the question is very large, and but I think that perhaps we have to differentiate between what happens at the local level and what happens at the national, regional, or international level. I think that at the local level, it's really important to have something that will be able to answer what people live and what people feel. And for that, we don't have a lot of evidence basis on what we call evidence in public health, because we don't have enough evaluation, we don't have enough professionalization. But it's really important to move forward. That means that to be able to support the communities when they face and when they have to challenge the effect of climate change on health. At the national and the international level, I think it's something else, because we have to influence the policymakers at that level in order to develop policies. And the question on evidence is the question of how we can evaluate public policies. And this is something that we can do, but we don't do this enough in public health.
Eric, Aleksandra, any inputs on this, or?
Yes, maybe from them sort of, my experience in working for many years on climate change adaptation, it's very tricky to sort of show that something has worked. It's very easy to show the costs, either in terms of human health, lives, or economic costs of a disaster happening. It's very tricky to show that something that was done actually prevented the costs. But I just wanted to mention maybe one example from Poland, my home country, that was affected by floods in autumn last year. Many years ago, a similar flood happened, and a rather unpopular decision was taken to build a big polder to collect the water and prevent the flooding of one of the big cities. Again, it was extremely unpopular decision. It required relocation of several hundred people and so on. But the last flood showed that it actually worked, that the flood was of a similar magnitude or even larger, but it prevented the flooding of a big city and a sort of, health implications and economic implications for many tens of thousands of people. And I think that was one of the things that really changed how people perceive interventions like that, because they could actually see that it saved. So this sort of polder went from being unpopular to being, having its own, social media fan page or something like that as a solution that has really worked. And I think that, if we can find examples like that and sort of, trickle them into the public consciousness, that would certainly help the cause. Thanks.
Yeah, thank you, Aleksandra, Laurent, and Daniele. Unfortunately, because of the limited time, we have to cut short our discussions, but we have so far have a lot of informative presentation on how to proceed from here and to be involved in the subjects of climate and health. So because this is our last sessions, I would like to thank everyone that has presented, and I would like to invite Daniele to present the informations on final exams and also to give a closing remark before we close the sessions. Over to you, Daniele.
Thank you. I think all of you are very interesting and curious about the final exam. So the exam will open today at 6 p.m. set time, and it will close on Sunday at 11:59 p.m. So it's like Cinderella. You have to conclude the exam. You will receive an exam link in your email and in the WhatsApp group if you are part of the WhatsApp. and you can only log in once. So make sure that you have time to conclude the exam. So then you can log in and you can finish your exam in one sitting. The exam must be completed using the same email address that used to log in all the Zoom session and also to register to this course. There will be 25 multiple choice and true or false questions. The system can't save answers, so you need to complete your exam in one session. There is no time limit. You can take 2 hours, 4 hours, 5 hours, but you need to, once you start, you need to finish. You will receive your score at the end. So, sorry, can you come back? Yeah. If you need to score at least 17 to pass in the exam. And if you score 17 and you attend more than 7 sessions or more, you will receive a certificate. The certificate will be issued in 2 weeks after the last day of the exam. So after Sunday, we will analyze all the materials and the final exam and attendance, and we will send the certificates. And at the end of the exam, you will be invited to take a final survey, the longitudinal survey, where you are going to complete a self-evaluation about your skills related to this gain in this course. And after 12 months, you will be invited to another survey. We want to evaluate our impact because sometimes it's so hard to evaluate our impact only in the numbers of people that we have training, but we would like to know more about you, how this training will collaborate in your professional life and how it will change and what kind of activities that you start to be engaged or that you that enhanced your capacity to act after this training. So make sure that you participate in this 12-month survey, it will help us a lot to understand our impact and how we can also provide you with more information, because we will ask how we can help you more in develop your skills. Next, please. And the post-session survey, so please evaluate this session, and we will put the link in the chat, and I will also put the link in the WhatsApp group later. Thank you so much. I will pass to
I think Professor Enrique Barros just arrived, so if you could say a few words for the closing, that would be very much appreciated.
Okay, so thank you so much, everybody, for being here, like more than 1,000 people during these 10 sessions. And my last message to you, it's sometimes it looks like it's very complicated, and there are so many pieces that we need to put together to have a resilient health system. But we can't wait to the gold standard. We can't wait to have all the pieces. We need to act now. And I want to say that everybody in this field is learning. So don't be afraid to act. Even if you are not 100% secure, we need to act now. So be courageous and make the changes. Thank you so much.
Thank you, Daniele. Professor Barros, the floor is yours.
Oh, thank you very much. First of all, I'm sorry I could not join today because I was in a meeting with colleagues from another country that visit us at our university. But I want to say that as an ASPHER member and as a member of the ASPHER board. We are really delighted to continue this consortium, this kind of work together towards a better health through a better management of the climate as part of our daily activities in health. I think this course has been a tremendous success by the number of people that show up for every section. It has been great also because of the quality, the tremendous quality of the presentations, the discussions, and allow me a special thanks to Professor Laurent Chambaud by being the person that make a lot of work so that ASPHER could be a partner and be present for schools in Europe, but also for schools around the world. I think this is a major opportunity to address one of the most relevant topics in health nowadays. So thank you very much for this excellent course, and I hope we will continue to do common activities in the near future. Thank you very much.
Thank you, and thank you everyone for joining. And now we will close the session and the course, and wish you all a very nice end of the day wherever you are. Thank you.
Thank you, everyone.
Thank you. Bye-bye.
Bye-bye. Thank you.
Laurent, do you want to say something? Or
No.
you have your hand. Okay.
Bye-bye to everybody.
Bye-bye.